Microphone for the speaker, please. Microphone for the DG, please.
Colleagues have done a very creative way of telling you whatever you eat, the sugar content of either a bottle of drink, either an orange. A big orange is 4 lumps of sugar. I was a bit surprised. And a good cucumber is 2 lumps of sugar. And I took one of these. I need to find out exactly.
One.
Are you sure? Is that scientific?
Oleg is always scientific.
But, thank you, and I'm so happy to see so many of you here. This is truly a very good way to celebrate our birthday. And the 7th of April of every year is WHO's birthday because WHO was set up in 1948 on the 7th of April. And every year, 7th of April, we choose it to promote a very important subject. And it is really wonderful to see so many of you here to promote a very important subject, attention on a very important subject called diabetes. So back to you. I was just impromptu, and so doing this, sharing of my passion on this very important subject with all the participants who are here in this room, but also joined us online. Back to you.
Right, well, thanks very much, DG, and good morning to all of you, Excellencies and dear colleagues. I'm Etienne Krug, Director for the Department for Management of NCDs, Disability and Violence and Injury Prevention here in WHO. And welcome, but also happy birthday, as DG said. This is our birthday, this is our celebration. Today we're all 68 years old, and we're celebrating WHO's achievements over these 68 years, but also drawing attention to an important public health issue, diabetes, and launching our first ever global report. And we are delighted that our DG is here with us this morning. Thanks, DG, for taking the time. And I'd like to actually hand over back to you for your welcome remarks.
Dr. Krug, let me once again send a very warm welcome to all of you who join us here in this room today, but also to all colleagues around the world who join us online as we celebrate the World Health Day. As I mentioned, every year we set aside this day, the 7th of April, to commemorate the establishment of WHO in 1948. I think, very few people in this room would be as old as WHO. Don't you think? Oh, you are in competition with me now. So all of you are so young and so, important for your country's development going forward. So it is really heartwarming for me to see so many of you joining us. As we said, this year we highlight diabetes. As a special, disease, it is a very challenging disease that deserves much, much more attention. The impact of this chronic metabolic disease on individuals, on families, communities, health systems, and health budgets is staggering. The concern is universal. Diabetes has long considered as a disease of rich societies. But diabetes is now increasing its prevalence everywhere, with the most striking and devastating increases seen in the developing world. Worldwide, the prevalence of diabetes has doubled since 1980. WHO estimates that 422 million adults had diabetes in 2014. When diabetes is not detected early and not controlled early, the health consequences are dire. Diabetes can damage the heart, blood vessels, kidneys, eyes, and nerves. For example, lower limb amputation rates are from 10 to 20 times higher among people with diabetes. It's mind-boggling, right? Amputation. Amputation, that means people cannot properly function as an individual with their given potential. In poor populations everywhere, the cost of managing diabetes can be catastrophic, pushing households below the poverty line. The costs are likewise crippling for health budgets and national economies. WHO estimates that each year, diabetes costs the world nearly $830 billion only in direct medical costs. And we have not factored in other costs to the family, to the individual, to the productivity of the country, and to the economy. Diabetes debilitates, and it also kills. Diabetes is responsible for about 1.5 million deaths each year. High blood glucose levels contribute to an additional 2.2 million deaths, mainly by increasing the risk of cardiovascular disease. Many of these deaths are preventable. The lives of people living with diabetes can be improved by expanding access to essential medicines, including life-saving insulin, and making technologies such as those used to test and measure blood glucose level more readily available. At present, insulin is generally available in only around 23%. Let me emphasize that figure, 23% of low-income countries. Only 23%. In such settings, diabetes patients who depend on insulin for survival pay the ultimate price for this failure to make essential medicines and technologies readily available and affordable. The 2030 Agenda for Sustainable Development sets a very ambitious goal for reducing premature mortality from 4 non-communicable diseases, and including diabetes, by 1/3. This is truly ambitious, but against the background of what I have just told you, many things need to be done by all of us. Of course, the SDG also set other targets and call on countries to reach universal health coverage and ensure access to affordable essential medicines. WHO, on our own Global Action Plan on NCD, seeks to keep the rise in diabetes and obesity, to stop that increase by 2025. So, ladies and gentlemen, we have a great deal of work to do, but we also have good guidance. Today, we are launching the first WHO Global Report on Diabetes, and I hope that each and every one of you have a copy of this. This is a good guidance. The report makes an important contribution to our understanding of diabetes and its consequences. Its recommendations are a call to action on multiple fronts. Data set out in the report underscore the need for action, not only from people living with diabetes, but also from different sectors of government, healthcare providers, civil society, and manufacturers of medicines and medical technologies. We also need to engage the system that produces and markets our food, FOOD. I invite all of you to do your part. In your personal lives, this means eating healthy foods, being physically active, and guarding against excessive weight gain. Have your blood glucose measured periodically and strictly follow the advice of your healthcare providers. In fact, the diabetes crisis and its huge costs provide one of the most compelling incentives for preventing excess body weight through diet and exercise. This point was strongly underscored by the Commission on Ending Childhood Obesity. Ladies and gentlemen, obesity in childhood can be a direct cause of accelerated onset of diabetes, which was once considered an adult disease. This is no longer the case. We are seeing more and more childhood onset and diabetes in adolescents. The prevention of childhood obesity must start with good nutrition in mothers and fathers even before pregnancy begins. For governments, reducing the diabetes burden means putting policies in place, good policies that promote healthy eating and physical activity throughout the life course. Well, I'm 68 years old as David Cho. I'm still very active. And you look at how fit I am. I'm not obese, definitely. So, I walk my talk. And as a DG David Cho, I need to set an example. And I'm proud to be setting that example. Eat properly, healthy, diet, and do physical activities as much as you can. But people will say that activities alone will reduce weight. No. That's an important contribution. It is diet. It is what you eat. We have to be very careful. And one such good policies that government can put in place is to promote breastfeeding for as long as, the mothers can do. Of course, we recommend certain duration, but if you can prolong that duration, your child gets more benefit. And we need to protect children from the marketing of unhealthy foods and beverages. Something we need to do. And I congratulate those countries who put heavy tax on sweet drinks. Keep doing that. I'm not very popular with that, I know, with certain sector, but that's okay. As long as people are healthy, our children are healthy, I don't mind to be the target of a certain sector. Now, not just, the food we eat, the exercise we do, it also means improving the diagnosis and treatment of diabetes by putting in place standard protocols and making the necessary medicines and technologies readily available and affordable. And since the inception of WHO in 1948, 68 years ago, WHO has drawn on the power of population-wide preventive strategies as a way of lowering morbidity and mortality, not just in diabetes, but in many of the diseases that are important to the countries of this organization. On this World Health Day, diabetes represents a prime opportunity for putting this power to work. The payback will be immense, and I thank you for joining us to celebrate our birthday today. Normally, I'm a good singer, but today I try not to sing because I have not so good a voice today. But in addition to celebrating the World Health Day, I also would like to take this opportunity to announce to you, we are very pleased that on this special occasion, we honor our staff who have, make tremendous contribution to the work of this organization, to support your countries, to make your people healthy. We honor, teams or individuals, and by giving them WHO Award for Excellence. The list will be sent to you by email later today, and let me personally take this opportunity to congratulate all recipients for their exceptional contribution to the work of WHO in 2015. The initiation of this system of honoring excellence, in terms of performance, underscores the value WHO places on staff performance as central to our efforts to constantly do a better job. I'm happy to see the President of the Staff Association joining us. So thank you for the collaboration. We have different ways to recognize colleagues' performance, but starting from this year, we must do it in tandem with our World Health Day as a celebration. There's no better way to celebrate your birthday, isn't it? Thank you, and I just want to, once again, appreciate you being here with us and give us your advice, your feedback on what you like and what you don't like about this celebration this year. And we will continue to improve. Thank you very much.
Well, thank you very much, DG, for highlighting the far-reaching consequences of diabetes and where we need to go from here in terms of stepping up our response. Just a quick message to those of you standing in the back. I know standing is more healthy than sitting, so if it's a deliberate decision, you can stay where you are. But if you want a chair, there's a lot of chairs here in the back, so feel free to walk in and take a chair. So let's take a closer look now at the report that is being launched today, has been launched today by the DG. And as I introduce my colleague, Dr. Cherian Varghese, our coordinator for the management of NCDs. Since we are celebrating staff today, I also want to recognize quickly the many staff in the department who worked many evenings, weekends, had sleepless nights developing this report. So Alison, Goika, Laura, Hélène, Pascal, Belinda, Joël, Angela, and the many others, thank you very much for your efforts. And thank you also to the many colleagues in the other departments. I'm thinking prevention of NCDs, nutrition, essential medicines, health statistics, DCO, Joint Medical Service for the sugar table. Thanks to all, it's been a great collaboration in developing this report. Cherian, please tell us what's in the report.
Jane, I will just take you through the report briefly. And as has been mentioned, diabetes is a very serious chronic disease characterized by elevated blood glucose. There are two types of diabetes, the type 1, which is mostly genetic and starts early in childhood, and the type 2, which occurs in adults, and also there is the gestational diabetes mellitus. Diabetes has been on the global NCD agenda, as you know very well, starting from the UN political declaration. It is in the time-bound commitments. There is WHO guidance and a target specifically on diabetes, and it is also part of the SDG targets. The risk factors, the exact causes of type 1 are not really known, but type 2 we know is overweight and obesity and physical inactivity are the strongest risk factors. Fetal and early childhood nutrition will affect future risk. Diabetes affects the body in a systematic manner. It almost affects all parts of the body. As an internal medicine specialist, one can actually look at the entire body through diabetes because it causes blindness, stroke, heart attack, kidney disease, and leads to amputations and other conditions. The main finding in the report, we had 108 million people with diabetes living in 1980, which became 422 million in 2014. That is a massive increase in the last few decades. And the rise, as has been said, has been much higher in low and middle income countries. So there's a much steeper increase of diabetes in the relatively poorer countries of the world, which bears the maximum brunt of the disease. Diabetes leads to 1.5 million deaths directly, and the total deaths due to elevated blood glucose is 3.7 million. And the most important part is 43% of these deaths occur under the age of 70 years, contributing substantially to the premature mortality from NCDs. The economic impact, as has been mentioned, is about $827 billion US, and it is estimated that if you look at the losses in GDP worldwide, from 2010 to 2030, it will be almost US $1.7 trillion. This cartoon represents why this all has happened. Look at the change in the world in the last for so many years. We had huge televisions which did not get into our house and which became very thin, but somebody else took the space. So we have 1 in 3 people who are overweight and 1 in 10 who are obese now. We need a life course approach, as DG mentioned, starting from early in utero, going through a multi-sectoral approach, a combination of fiscal policies like taxation, legislation, regulation of marketing and labeling, changes to the environment, and raising awareness can promote healthier diets and physical activity. This is an example of DG leading the healthy workplace in WHO. WHO, as you can see around, is going to be stepping up and using stairs and other physical activity. School-based approaches are also a very good opportunity to do multiple interventions, including diet and physical activity. But type 2 diabetes can be delayed or prevented if we identify people at an earlier stage when they have an impaired fasting glucose, and good interventions with diet and physical activity can revert the stage even without medication. The sad part is a high proportion of type 2 diabetes is undiagnosed. Almost 30 to 50% of people with diabetes do not know that they have diabetes. So that's why the early detection and management of diabetes becomes very important. WHO package of essential NCD interventions offers you a good set of interventions that can be done in primary care with a small set of generic medicines, improving self-care, and regular screening for early detection. It's also important to integrate diabetes with other NCDs, with TB, which is very common, with HIV, and with maternal health. So these are platforms which offer you options to expand the diabetes cover. As mentioned, access to affordable insulin is critical, and people with type 1 diabetes require insulin for survival. And low-income countries generally pay most for insulin and compared to high and middle-income countries. WHO does national capacity, and we looked at the capacity for responding to diabetes. 68% of countries have operational policies for diet and physical activity. When it comes to good management, only 47% of the countries report full implementation of guidelines for management of diabetes. And only in 1/3 of low and middle income countries, they have all three basic technologies. So what are the main recommendations? We need to include diabetes in the national integrated NCD response and also in related health programs. Set national targets, including the target for diabetes. Prioritize prevention of overweight and obesity, starting with breastfeeding. Create supportive built and social environments. Consider fiscal policies. Get into a standardized management program for diabetes in primary care and reduce the gap in diagnosis of diabetes. And we need to continue to measure and monitor the prevalence and outcomes. Thank you.
Thanks very much, Chirian. I mean, the statistics are very clear. 1 in 11 today live with diabetes around the world. The media have picked up these statistics. They are going around the world too very quickly now, and we hope this will generate action. But I think it's important we hear from those who live with diabetes, because nobody knows better than them what this means. And we're very fortunate to have today two people who have come to share with us their experience of living with diabetes. Florence Banda, a young leader in diabetes from Zambia, and Maria Fernanda Bria, a WHO colleague who's with us here from Argentina. I'd like to start with Florence. I mean, thank you very much for being with us today. You're from Zambia. It would be great to hear a little bit more about your experiences of living with diabetes in your countries, what it means for you as well as for people in general in developing countries. Florence.
Thank you. I'm the WHO Director, General, Dr. Margaret Chan. The countries represented, fellow people living with diabetes, ladies and gentlemen, let me simply say all protocols observed. My name is Florence Mimi Banda. I come from Southern Africa in a country called Zambia. I come from a middle-class family and was raised by a mother who was widowed in her early 20s. She single-handedly raised all 7 of her children. She is a woman I celebrate. Middle class in my family is when, in my country, is when one can have basic accommodation and at least 2 meals a day. I feel honored to have this opportunity to speak at this conference, and most especially speak about my challenges living with type 1 diabetes in Africa. I was diagnosed with type 1 diabetes at the age of 16. Before the diagnosis, actually, which I must say was accidental, I used to get sores, would take long to heal. I lost weight. My sight became bad, and I passed a lot of urine. I became very sick, and my mom took me to the clinic to be checked. Although I was tested and found with no malaria, I was given treatment for malaria. It didn't at all improve, and my mom took me back to the clinic after a week. And I was given a double dose for malaria. At this point, I had become 2 weeks such that I could no longer walk and had to be carried. Lack of adequate knowledge on diabetes by our health staff was the biggest handicap. My family was advised to take me to a private clinic where several tests were conducted. Note that private clinics meant that my family had to pay from their own pocket, and the amount was so high for a middle-class family. One of the tests that was taken was a rapid sugar test, which showed dangerously high levels of sugars. But the doctor advised that I come back the following day because I had taken a meal and they had to test me before the meal. So I went back the next day without eating, and my sugar levels were extremely high. I was referred to go to the General Hospital, which is the university teaching hospital. I was admitted at 10 a.m. at the government general hospital, but was only attended to around 7 p.m., and that was because my family went to confront the doctor on duty. Our public health facilities have high levels of negligence, which is appalling and lethal. From that day, my journey with insulin began, which I live on to date. The life of injections every day. From then on, I had to leave home at 4 a.m. to be on a queue just to have a chance to be seen by a different doctor every time. And that is because I had to wait 3 months for such an opportunity, even when the hospital opened at 8 a.m. The hospital do not allow to be seen without an appointment. So if you don't have an appointment, you cannot go to the doctor. You have to wait for your appointment date. Many children move from pediatrics to adult clinic at an early stage without good transition stage. And our health staff are not adequate for the demand. We have shortage of staff in most public hospitals. In 2012, I experienced severe levels of low blood sugar resulting from a dose of insulin. I have had to be unconscious for hours. And in 2013, one endocrinologist told me to do some tests, but most of them I could not manage because they were very expensive and I had to do them from private clinics. Most public and government clinics do not have these tests. I suppose due to many economic challenges the country is facing, and I know there are many like me who cannot afford to access those tests. Zambia, like many other African countries, provides free insulin in the public health facilities, but they often run out due to they give the insulin free of charge and they do not consistently have the insulin. Inadequate insulin in public health facilities and affordable cost of drugs and treatment. Public hospitals also have shortage of staff and lack of medical equipment and resources. I do not doubt that my experience is no less different from the next average person in Africa with a similar condition. In my journey, I became a member of the Diabetes Association of Zambia, where I have been involved in creating awareness on diabetes. I have gone to speak in schools across the country and featured on documentaries. Diabetes still remains a strange condition in my country and Africa as a whole. Most people are not aware of the condition. I have known friends from the association who have died before they turned 20 and others in their early 20s. I am sure there have been many more who have died not knowing they have diabetes. There is no diabetes awareness and appropriate medical care. It is worse in the rural areas in Africa. The most important component is awareness, because even when people have the required medical supplies, without the knowledge, they may not use it properly. General public awareness on diabetes is a must. Young people living with diabetes in my country and Africa have no psychosocial support in the community. They are viewed as being sick and are left out of meaningful employment. I have been a victim of such. That is why we sat down with my member association and designed a project that would create support groups from young people living with diabetes, with an aim of creating awareness across Zambia. In 2013, I had a chance to attend the IDF Young Leaders in Diabetes Conference and found more information that is not given in most African countries. There is currently little information stored or in the media on diabetes, making it very difficult for an average person to research on diabetes. There is a loud cry for access to appropriate medical care, improved medical facilities and technology, access to support, access to information on diabetes, and equal employment opportunities. We need everyone for meaningful development. And today, I implore WHO to work with governments and private sectors in consistency and availability of insulin and medical care. I am currently applying to study public health so I can help in my country and the world as a whole in diabetes and health issues at a higher level. I want to acquire knowledge to influence policies to support people living with diabetes. Every life is meaningful. Help young people living with diabetes live healthy and meaningful lives. I thank you.
Thank you very much, Florence, for coming all the way from Zambia to share your story with us and highlighting some of the challenges in diagnostics and access to medicines you faced and many others face around the world. You told me yesterday also that one day you hope to work for WHO, so we hope to see you back here very soon and hopefully maybe even in the DG's chair one day. Good. So on World Health Day, we also wanted to hear from a staff member what it means to live with diabetes and work with diabetes here in WHO. So I want to thank also Maria Fabiana Bria, who works in records and archives here in WHO, for being with us today and sharing her story. Maria Fabiana said she would be more comfortable speaking in Spanish, so I encourage you to take the interpretation device. And I'm going to switch now to Spanish, so muchas gracias.
Thank you very much, Maria Fabiana. Thank you very much for being here with us today on World Health Day. Diabetes has often been called a silent illness because people live with diabetes without having been diagnosed for many years, and this can lead to further complications. This has been your experience, and perhaps you can tell us a little bit more. We heard it from Florence about the challenges that she faces in Africa. Are there the same challenges in Geneva or not? Thank you very much. Can you hear me? Yes? First of all, thank you very much for having invited me to speak. It is with great pleasure that I'm here to share my experience. And yes, indeed, this is a silent illness, as you mentioned, because in my case, for example, 13 years ago, about in 2003, I started to experience certain symptoms such as having excessive thirst. I went to the bathroom a lot. I was very tired, and I had lost about 7 kilos. My friends and colleagues used to tell me, "What diet are you on? Because you're so thin. You've lost so much weight." Well, how did I find out? Well, I lived through this with many months. How did I find out? Well, one evening, I was reading a journal, actually the newspaper Dimanche Matin, that is published here in Geneva. I was reading this article in the newspaper, and the article was speaking about all the symptoms that one can experience if one has diabetes. And I said, no, impossible. This couldn't be happening to me. I am healthy. I do exercise. Nobody in my family has or has had diabetes. Impossible. Complete denial. Well, that same day, my boyfriend told me, let's go to the hospital this evening. We went to the hospital, and they took me to the emergency room, and that's where I was left. I stayed there for 4 days, and I was diagnosed with diabetes of type 1, insulin-dependent diabetes, from one night to the next. I really remember very well the comments made by my parents in Argentina when they found out, and they called me. Right away, they told me that despite having heard this bad news, Thank God this diagnosis was given in Switzerland, because we imagined that in Argentina it would have been a completely different experience. In Argentina, health insurance is not even mandatory. And of course, they didn't know anything about the treatment for diabetes in Argentina, and I'm sure that there wouldn't be the same type of follow-up that there is here in Geneva, especially. And this is my experience because I have lived here in Geneva, and I've been a diabetic for the past 13 years here in Geneva. You were speaking about some challenges that I have faced. And to come back to what Florence was saying as well, it is true that it has not been easy, but it is not impossible to live with diabetes. You can carry out pretty much normal life, at least here in Geneva and in Switzerland, where we can access all sorts of treatment and care. We have fantastic medical treatment. And I remember that one of the main challenges of being diagnosed with diabetes, type 1 insulin-dependent diabetes, was to accept this diagnosis, accept the treatment, and get used to this whole new lifestyle. I know that many patients go through this. They are in a state of denial. They say that it is not severe, that they can live as they always have. And this really is very difficult because the first stage of acceptance, we should call it this way, the stage of acceptance, we have to take our glucose 5 times a day. We have to inject ourselves 5 or 6 times a day with insulin. We have to remember when we eat, when we do exercise. We really have to be very attentive to the symptoms that our body can emit. For example, our body will not always tell us if the sugar is very high or very low. So it's a whole learning process. Once we have gone through this learning process, then we go through a period of reflection. I think that having diabetes here is really, in a way, to be lucky because we have a whole team of specialized medical doctors here and staff and that are specialized in diabetes. There are hospitals here, such as the HUG, the University Hospital in Geneva. I remember Mr. Cimarelli and Mr. Montserrat that helped me tremendously to accept the treatment and did something absolutely key. They told me that, Maria, you're the only responsible person for the success of this treatment and your health. So really, they made me responsible for my own illness, accountable for this illness, and to really take up ownership of this condition. And I always remember their kind words. Another challenge was in 2006, 2007. This is when I decided to have a child. I had a wonderful pregnancy. And of course, I was really followed up constantly throughout the pregnancy with the medical staff. I saw the nutritionist. I saw many different experts, and people feel that they are really being cared for very well. The problems only arose after the pregnancy. Everything went well with the delivery, but we had to have an urgent cesarean because my child, who is now 9 years old and who is very healthy, my child was 4.6 kilos, so she was a huge baby, and therefore we had to have an emergency cesarean operation. The challenge really was the post-pregnancy period for me, because then I had to have family balance between breastfeeding, coming back to work, and having diabetes on top of everything. So it was really quite a difficult, challenging period. But here we are. Everything went well. And that's everything I had to say to you today. Thank you very much. Thank you very much, Maria Fabiana.
Es claro.
It is very clear what the differences are. They're very obvious of having diabetes here in Geneva and having diabetes in Africa and all the challenges that exist. The report also speaks about the importance of our workplace and the role that it can play in the daily life of people suffering with diabetes. What is your experience of working here at the WHO, and how can we improve? Microphone, please. Yes, I think you can hear me. Well, some suggestions perhaps. Now, related to communications that exist here, for example, between my doctor and the doctor that is responsible for medical services of the WHO, there was a lot of dialogue between the two, and I was able to reduce my working hours. I work now 80%, and this was absolutely essential for me. This was very helpful, especially when my daughter was born. The WHO was really attentive to my personal needs then. And then something else that is very positive is the new program called Walk the Talk. I'm not very familiar with it, but this will encourage us to eat better and take more exercise. And I think that that's a very good balance to have. And I would like to also especially mention here a program that is called the Global Corporate Challenge, which was launched thanks to the medical services last year in June. This was launched in June 2015. This program tries to improve the relationship that employees have with their own health. Once again, here we are talking about taking up ownership of conditions and illnesses. And thanks to this program, this was the first time that I, as a patient, a diabetes patient, was able to reduce glycated hemoglobin, which is called glycated hemoglobin, which is extremely important to be able to maintain stability, to be healthy while you're living with a chronic illness such as diabetes. I think that it would be a very good idea to introduce this program, the Global Corporate Challenge, as just another tool for WHO staff. The same was done a few years ago with a Full Awareness, a program called Full Awareness, which allows you to manage stress. And so this is a course in the whole range of courses that are available to WHO staff. And I think that this is really important. This comes from my personal experience, and this allows us to take awareness of our health and our responsibility. Lastly, just to wrap up, I was talking about the difficulty between balancing our family life, maternity, having a child, and working. I think perhaps it would be a good idea to set up a nursery for children. I think that this would allow us to all be much healthier as employees of the WHO. I have many more ideas, but not enough time. Thank you very much.
Thank you very much, Maria Fernanda, for sharing your experiences and making suggestions to us. Let's now turn to the diabetes experts, and we're very fortunate to have three world leaders in diabetes with us today. Dr. Shaukat Sadikot, who's the president of the International Diabetes Federation, Dr. David Beran from the University of Geneva, and Mr. Hormuz Kaikhanzadeh, sorry, I probably massacred your name, from Iran, where he is the president and chief executive officer of the Gabric Diabetes Education Association. So Shaukat, thanks for being with us. The IDF has a long history of collaboration with WHO. Thanks also for the support in preparing this report and its recommendations. What actions do you and the IDF feel should be prioritized to halt the rise in diabetes?
Well, first of all, thank you very much for having me here, and I'd like to say hello and happy birthday to all of you. I'm a bit older than the WHO, but that's another point. Okay, now, basically, when we're talking in terms of preventing the rise in the number of people with diabetes, I think it goes back to a long way and something that Dr. Chan has already said, and that is total lifestyle management. And I think unless we do lifestyle management, I don't think that we're ever going to halt the numbers of people with diabetes. At the same time, I think walk the talk and everything is absolutely fine, but whatever we suggest has to be something that can be done on the ground by the countries. Like I was telling you just now, 5 years back I was at an IDF meeting on prevention of diabetes. And there were these two people from the United States who said that, well, the only way to do it is India and China ban all escalators and elevators. Well, I mean, this coming from a country which has more obese and overweight people than anybody else, I think doesn't work. So we have to have certain initiatives and projects which can work. That is very important. Two, I think, and it was correctly pointed out, that it is not really a disease of rich people. In fact, in India, and that is true everywhere else, then if people have been living in a city all their lives, they are at risk for diabetes, I agree. But the number of people who are in transition, who come from the rural areas and live in the cities in order to earn a living, they're very poor. They've left the lifestyle of the villages again, so there is no more of walking. They're poor so that what is available is really calorie-dense food, which they eat. And they are the ones who have the highest number of people with diabetes. And I think that has to be looked into. The schools have to be looked into. So that is to be a prevention. But I think we also have to consider two things. That we already have around 420 million people with diabetes. And we've got to prevent problems occurring. Today, in India, diabetes is the largest cause of blindness. 1 in 3 people undergoing dialysis have diabetes. It is the largest cause of lower limb amputations after accidents. We've got to prevent these problems from occurring. In 2011, when the IDF came out with its atlas, 1 person died because of diabetes-related complications every 7 seconds. Last year, when we came out with our atlas, 1 person died every 6 seconds. Now you tell me, lots of new medicines have come out, lots of new knowledge has come across, we've attended hundreds of conferences. Why are we not able to do something to help the people with diabetes? At the end of the day, my knowledge and your knowledge and everybody's knowledge has very little value unless it is translated into doing something which will help the people with diabetes. And I think all our data collection and all our prevention really is fine, but we've got to do something for the people who have diabetes. And half of the people who have diabetes don't even know that they have diabetes. So what are we going to do? And I think we now need to really walk the talk, not only from exercise, but there has been a lot of talk which has taken place about diabetes and non-communicable diseases. I think we need to walk it and see to it as to what will we do that will make the lives of our people with diabetes better. Thank you.
Thanks very much, Shaukat. David Beran from the University of Geneva, as you've seen, the report identifies access to insulin as well as other diabetes medicines as deficient in many countries, and the DG also highlighted that in her remarks, particularly in the lower income ones. You've worked on this issue for many years. What key steps are needed in your view to improve the situation?
Well, thank you very much for this opportunity. I think really when looking at the issue of access to insulin, we need to differentiate 2 key components, is the availability, which Florence mentioned as an issue. Although insulin was free, it's not always there when it's needed. And so how can the push for universal healthcare coverage ensure that this life-saving medicine is included in benefit packages, that budgets that are put together, be it at WHO or within health systems, include these essential diabetes medicines? And also, WHO has vast experience in terms of improving the availability of medicines through supply systems, through support to member states, and how can that be used for insulin as well? In terms of the issue of affordability, what we see is the global domination of the insulin market by 3 companies. They can dictate what is on the market. We've seen trends in analog or newer or more modern, depending on the marketing term we want to use, insulins. We see pen devices, fancy delivery devices, and all of these drive up the cost of insulin. We once upon a time had animal insulin widely available. This is no longer the case. Will the same thing happen to affordable human insulin in vials? And how can WHO guarantee that that insulin in vial form will remain on the market? We don't have generic or biosimilar insulin available as we do for many other medicines. So how can WHO, through pre-qualification or other means, ensure that generic or biosimilar insulin is available? And for member states as well, we see that there are taxes, tariffs, markups within countries on insulin and other diabetes-related supplies. This is a tax on sick people. Member states need to see how these taxes can be removed so that at the end of the day, the people that and need their insulin get it at the lowest price possible. I'd like to congratulate WHO on reaching 68 years old, but we need to remember that insulin is approaching its centenary. This medicine was discovered in 1921 and was made widely available in the Western world in 1922. So this is not only an issue of access to medicines, but an issue of global equity. How can we celebrate World Diabetes Day when many people still do not have access to something that was discovered in the 1920s? I would just like to add, and I congratulate the WHO for highlighting the issue of access to insulin in its report, and would just like to quote the DG from the WHO report, saying, "People with diabetes who depend on life-saving insulin pay the ultimate price when access to affordable insulin is lacking." We need to address these issues of availability and affordability to ensure that this doesn't happen in this day and age, especially for a medicine that is approaching its centenary. Thank you.
Thanks very much, David. And finally, Hormuz, we've heard about the access to medicines, but also educating patients with diabetes about self-care is one of the pillars of managing diabetes. Can you tell us a little bit more about your experience on that in Iran and the results that have been achieved?
First of all, on behalf of my association, Gabrick Diabetes Education, I would like to thank WHO for giving me this opportunity. Today is very fantastic because instead of birthday cake, we all tried birthday yogurt, which was quite helpful for all of us. So thank you for this initiative. As an Iranian NGO founded in 2006, we are honored for the development of the model of diabetes education school based on IDF guidelines, but implemented in our distinctive model, which are characterized by key 4 features. And these key 4 features are supposed to address the main challenges of diabetes education. First, in our model, the majority of people working in the association are type 1 diabetics like me, and both the people who are diabetes educator or the people who are a counselor, which provide counseling to the members, they are all diabetic. So this provides the opportunity of giving a service full of empathy and in peer-to-peer support style. This is what we call collective education, and is supposed to address the adherence to diabetes education. As Maria mentioned, the acceptance of diabetes is very important, and peer-to-peer support style could be very effective. The second distinctive feature, due to extensive variety of patient educational needs, Gabrick Diabetes School training programs have tailored in 18 different courses covering 8 target groups and in 5 educational levels. So it is really a school having different courses offering based on different needs. Thirdly, experiential learning model is the basis of entire session in which all participants have to perform a homework, turning what they've learned into practice, log their blood glucose, diet and exercise, set a goal, and share their experience in following sessions. With the appropriate support of diabetes educator, behavior change is facilitated and the empowerment is gradually built. And the fourth is active follow-up system for our members in practice through telephone call by peer counselor and sending message, newsletters, events, gathering, and etc. Members are regularly asked about their blood glucose, about their A1C level, and are given motivation and educational tips when needed by peer counselor, by a person who already have such problem. I would like to refer to one of our novel courses that are specifically designed for children with diabetes. Children needs, of course, different languages. We have developed Kipo, who is the hero of this program. Kipo is coming from Sugarland, which is an imaginary planet. All the people there have diabetes, and in these Kipo adventure stories, children are gradually get understood about the importance of diabetes management. For example, Kipo have horn and has some magical power. We cannot tell a child that if you fail to manage blood glucose, you will end up kidney failures. But Kipo, the hero, if the Kipo fails to manage the blood glucose, Kipo will lose this magical power. So these kind of innovative stories can help the adherence to diabetes education by children. And finally, and in conclusion, I would like to say that this model can be implemented in other countries, and I can say this model is a combination of entrepreneurship, innovation, empathy, and experience, and now supporting 100,000 Iranian people living with diabetes, and is in line with Iranian Ministry of Health national policies. Thank you.
Thank you very much, Hormoz, or should I say Kipo. And thanks to our three panelists. We are running a little bit out of time. We had planned for a discussion of 15 minutes or so. Maybe we can do 5 minutes if that's okay. Is there anybody who would like to make some comments, ask some questions to the panelists, or any additional remarks? Okay. I knew I was taking a risk. I can only take 3, I think, and really, really short, focused remarks. So, Ecuador, let's start with you.
Thank you very much. It is an honor and a pleasure to be able to celebrate in this WHO Celebration Day of Health. Thank you very much for having launched this first global report on diabetes. It is always a pleasure to be able to feel your energy and motivation, Madam Director General. In 2011, the leaders of our countries at the United Nations recognized that non-communicable diseases are the greatest challenge of this current century. And here I can see that there are many familiar faces sitting around this table. We are all working very hard for our ministers of health. In 2014, we ensured that they committed themselves in Rome at the Second International Conference on Nutrition to reverse the trend on being overweight and obese in all age groups. Last week, there were many different consultations and discussions. The General Assembly finally endorsed the Rome Declaration and the Framework for Action, which perfectly aligns itself with the 2030 Sustainable Development Agenda, as the director already mentioned. In line with this, Ecuador would like to say that we are very proud to be part of the countries that endorsed this declaration, the decade of the United Nations 2016-2026, to improve nutrition. We have great hope that the WHO will play a key leadership role in supporting states in developing and implementing national plans for better nutrition. Coming back to the World Health Day, to our celebration today, to not extend myself for too long, we would like to really focus on diabetes. We think that this is absolutely crucial. 422 million people, especially people from developing countries, are suffering from diabetes. We can see that their standard of living has decreased because of this illness. And today we have had the privilege of hearing 2 personal experiences, thanks to Florence and thanks to Maria, of this cruel reality. We heard about the reality of living with diabetes all over the world. The risk of diabetes type 2, according to scientific experts, can drastically reduce through healthy diets and through physical exercise. This is great news. We hope that this news can be disseminated at the worldwide level. Thank you very much for your example, Madam Director General. Now, regarding the report, we do think that this report is very comprehensive, very important, and we see that that you have emphasized prevention and control of diabetes. We have heard many panelists speak about how we can improve diagnostic tools, detection, and complications. We are very encouraged to see that through concrete measures, we are able to reduce by 30% mortality due to NCDs, and this by 2030. Once again, thanks again, and we would like to extend our congratulations again. Thank you. Mike.
Thank you very much, Excellencies. I'd like to congratulate you on the anniversary of the WHO. We recognize the first report on diabetes, and one gets the feeling that the first thing that we feel is anger. And as you said very well, madam, diabetes is a silent killer. It's a silent illness, so it often goes unnoticed and is often seen as a silent disease that affects the entire world. And by 2030, it could be one of the main causes of mortality globally. At the same time, this anger is strengthened by the fact that very often the prevention means are very expensive. And this has been said, treatment is very expensive. But this also places a burden on societies and communities, and it's something that's very important indeed. It's simply not acceptable in the 21st century that we have the status quo. On the other hand, it may sound contradictory, but it is a ray of hope. Thanks to this first report, we have identified the mechanisms and the causes, the root causes of diabetes. And we have areas of reflection that we can bring about changes and solutions. And this all works, it ties in with the SDGs. We have specific targets here on NCDs. And this is where the WHO can play a key role. My country is not spared by diabetes, of course. Prevention measures have been put in place and are being put in place. They have a cross-cutting scope, because national education has a key role to play. Sporting activities are promoted, and of course all of the insurance sector and medical sectors are present and involved in this process. We have testing and advice days that are organised in Monaco. In school, we teach children to exercise and to eat healthily. That's what I wanted to say. Thank you very much.
Thank you very much, Monaco. I'm really sorry. I see many of you want to speak, but we are totally out of time. So I'm going to maybe give the floor to the US, and then Dr. Chesnov will close the event. Thanks for the understanding.
Okay. Thank you very much, Etienne, and thanks, DG, as well. And it's great to be here for this World Health Day. Sorry. Okay. Hope I'm close enough. Thanks. It's great to be here for this World Health Day and to see this report. Listening to the presentations this morning, my mind goes back to the negotiations here in this room in 2012 and 2013, especially on the global monitoring framework. And as I recall, if memory serves, the diabetes target, which is to halt the rise in diabetes and obesity, was one of the last ones agreed. And many delegations at that time called it the stretch target in a way. And they did so a lot because the evidence in terms of interventions and how to make things happen on a system-wide basis weren't necessarily there. So we want to really thank and appreciate and commend WHO for the work on this diabetes report. I think it takes us all forward very well. As the U.S., we strongly appreciate the emphasis on prevention and education, especially of consumers. We also recognize that there's a lot more work to do. As others have talked about, physical activity is one that there really needs to be a lot more work at country level and collectively. And DG, your Commission on Ending Childhood Obesity really clearly articulated that need. The United States is committed to supporting WHO's continued leadership and advocacy in this area. Thank you very much.
Thank you very much, US. And I'd like now to turn to Dr. Oleg Chesnov, ADG, Non-Communicable Disease and Mental Health, to close the event.
Speaker's microphone, please.
For each birthday, what is important? Important present. So we received today present. We have a very good subject for discussion. And once more, we appreciate all of us that we are raised this very important subject for discussion, and we are raised it on the highest level. Especially, I also want to thank to the DG, because each time when we are discussed what will be subject for the World Health Day, it is also always competition, and we already 3 times win in our cluster. Thank you very much. And I know that also next World Health Day will be also in my cluster. Now, second, my role is just to invite you to the birthday cake, which is today is replaced, how it was correctly said, by yogurt, and we also we have a watermelon. And could you join to the DG and me? It's served outside. Thank you very much for your participation, and I wish you a successful day. Thank you.
May I take 1 second to make a very short comment? Because I don't want Dr. Chesnov to give the impression that the DG is biased to his cluster. And on successive World Health Day, I chose very important topic from non-communicable diseases, because worldwide, premature death is #1 due to heart disease, diabetes, cancer, and all these important. So WHO is a science organization. Our most important underpinning is evidence. So, and these diseases are preventable. All these premature death and the diseases are preventable. So today, you know, I want to call on you individually, as a group, as a citizen in your country, talk to your leaders, and let's take action. Let's go out and cut a melon to replace a birthday cake and to really walk our talk. Thank you.
Thank you. Thank you very much, DG, for mentioning the There's also a walk at 12:20 and a run for those who want to go at 12:20 at the main entrance. You can go for a walk or run in the walk the talk context. Okay.